blood test shows that the cat has an increase in white cell count and neutrophils, eosinophilia also, and a decrease in platelets. As far as the kidney and liver are concerned, also in this case the cat has lower hematocrit and hemoglobin, so going to be anemic. And as far as the liver and kidneys are concerned, they are normal. So overall it's healthy except for the lung tumor. Okay, let's hear the sound. Coughing cat.
Yeah.
But this was when? 2 months ago?
Yesterday.
Yesterday on. Yeah, wait on me. Just focus on it. This cat is 9 years old, male neutered, right? That's all. Then today?
Today.
Any coughing? So the coughing starts 3 months ago. Is there another one?
This is the one just now.
Another video or same video?
Another video.
And this
Yeah,
the whole day or just
No,
only?
no. A while, then nothing. Maybe one
A
day.
while then okay.
Is it only morning?
No.
No
No
time.
Maybe one day, few times.
But lately it's like every day.
Every
I
day,
notice
Yeah,
every
but
day.
not so.
So you saw the vet twice and then there was no
Yeah.
heart problem or
No
no lung
heart,
problem.
no.
That's all. And how's the food? Okay.
Food okay?
You can eat.
Yes, no problem.
Eat the same amount.
Yes,
Drink
yes.
the stool and urine. Okay.
Okay.
Everything.
Is there another cat in the house?
No.
One cat only. And only happened about 6 months ago or 7 months ago, right?
around that.
Duration 7 months ago. And it's getting worse, is it?
Getting worse.
Getting worse. So 7 months ago, was there any treatment?
No, because we that time once a while like that only he will come.
Then the antibiotics you didn't give, the vet?
No.
Not even one day?
No.
Did they give any
The
injection?
cough syrup, yes, I did
No
give him.
injection.
No.
Why are you against antibiotics?
No, because there's no reason to
Why
give,
must give him antibiotic? Yeah.
They never diagnose anything, they just anyhow give.
No, sometimes they have an infection of the throat, a bacterial infection, but they can't find it from the diagnosis. But then I will have a check first.
She gave cough syrup, but
No, she gives antibiotics second time.
Yeah.
Has he been the category boarding?
No, never.
Has he got the vaccination?
Yes.
Yes.
Every
When
every
was
year,
that?
Every year.
When was the last
The
vaccination?
last one is September.
Last vaccination.
Yeah, September.
That's good. So yearly one.
Yearly, yes.
Unlike other cat owners, they don't do it.
Oh no, we always.
Okay. Then no increase in drinking.
No, normal. All normal.
No increase in urination.
No, normal.
So just a cough. 18 January 2016, this male neutered cat, 9 years old,
Okay, Doc, 15 minutes.
has a history of coughing for the past 6 months. And the owner sent it to the first vet. The first vet wrapped the cat in a towel and prescribed some antibiotics, but owner didn't want to give antibiotics and didn't want the cat to be sedated for X-ray. So now, today, I examined the cat. There was a swelling, bigger submandibular lymph nodes swelling on the left side, and the cat didn't really allow me to open the mouth any further. So I suggested an X-ray and a blood test. Now the heart sounds and the lung sounds were normal, but there was rapid breathing. Now we look at the X-ray, and you can see that this is not normal. This is the tumor of the lungs, and it's a very big one. But This could be infected lung tumor. This being an old cat, and this infection causes inflammation, and the cat is trying to cough out the phlegm. So that is the reason that the cat's been coughing for 6 months, and the cough is getting worse recently. So now you look at the ventral dorsal view. And it's on the left side, as you can see. The left side of the lungs. There's a big lung tumor actually, or mass. And this mass is here. It affects the lungs, and the coughing. The cat is trying to cough out the infection from there. Infection from there, and then yeah, 6 months will get worse. The blood test is out already.
15 minutes, doc.
The blood test is out. Okay. So now with the X-ray as evidence, we know that this 9-year-old male cat has a lung tumor, and this contribute to the coughing, because the lungs are probably infected and not normal, and the tumor is growing. As you can see, it's not a small tumor, it's a large tumor. On the lateral view, you can see that this tumor is quite rounded, and so without the X-rays, the first vet couldn't really come to a diagnosis. And although they wrapped the cat in a towel to check the mouth, they said that the teeth was okay. The teeth were okay, and the owner didn't give permission for sedation. They wanted isoflurane gas, but it's not possible, as the duration is too short for all this examination. So now with this sedation, xylazine 0.3 plus ketamine 0.2 IM, and reversing to reverse it IM again. So it's quite safe, and it enables the examination to be done properly and thoroughly. I opened the cat's mouth and checked the teeth okay, but the 2 tonsils are enlarged as well. So the enlargement of the tonsils could be due to a bacterial infection, and so the diagnosis is lung tumors plus probably infection of the lungs, and the heart itself was normal as far as the auscultation is concerned. I confirm it's normal, but as you can see that it is the lung tumor. May have push it upwards. So the stomach is still full, so the cat has a good appetite. But the coughing has got worse and worse, becoming daily. So that is due to the lung tumor. So we need a blood test. Not ready yet, a blood test.
This one's not yet.
Blood test ready? Not yet, no? So I need 5 minutes more for the blood test. And the cat should be waking up with reversing soon. And as you can see, many owners don't want sedation because of the risk of anesthetic death. But without sedation, you can't do a proper X-ray, as the cat is very fierce. Now we look at the throat. No? There's some swelling due to the coughing actually. and physical examination shows that the teeth are clean for a 9-year-old cat. There's no tartar, and this finding, even auscultation of the lungs, there were no harsh lung sounds, just rapid respiration. So this could be a tumor or an infection. If it's an infection, antibiotics should resolve the problem, but it's just that it took 6 months for the owner to seek vet attention, and the first vet, the owner didn't want any antibiotics because many owners, they don't want to give antibiotics unnecessary to their pets. So now we have to wait for the blood tests to provide the evidence of bacterial infection of the bloodstream, so that the owner can accept the antibiotics to be given to the cat. Now, as far as the throat is concerned, there appears to be only tonsillitis, enlargement of both tonsils, but other than that, there is no lumps palpable. And even if we go downwards, it looks quite clear, except for this large mass here. It's most likely a lung tumor on the left side. And this is the heart. So auscultation reveals no abnormal heart and lung sounds by the first vet and me, but actually this could be a growing lung tumor, as the cat is 9 years old, but has not lost weight or has no fever. Toa Payoh Vets, January 19-2016. A cat who coughs for the last 6 months. The lung tumor starting from there, from this end to the edge, right? For auscultation, no rough sounds or anything. It's coughing for 6 months, getting worse recently. So it's a.
Okay.
Is it abscess? No.
Okay.
Okay. Yeah. How about the lateral view? You have a look. Lateral view.
It can be anything lah.
Have a look at lateral view, James. Lateral view. You see, for me, it looks very like. It looks like a very rounded tumor. No, I mean it. It looks very much like I don't know if it's abscess or not. But it's very. It's just very rounded, right? See, very rounded. Above the heart, right? It look like a lung tumor or abscess. Lung tumor is the whole lungs, not whole lungs, but this is not the whole lungs. It's only part of the lungs, right? That's why it's coughing every day, lah. Okay, thanks.